am Pam McConeghy, and I'm President and CEO of the Greater Brighton Area Chamber of Commerce, and I am joined by a couple of individuals from the Livingston County Health Department, and we're going to be talking about how the coronavirus has affected your business, or how it may affect your business, and how to take precautions. So would you introduce yourselves?
Sure. My name is Lindsay Gestri. I am the Emergency Preparedness Coordinator for the Health Department.
My name is Natasha Radkey. I'm the Public Information Officer for the Livingston County Health Department.
Things are moving very rapidly with this virus, and we want to keep our businesses as safe as possible. So we have some questions and we're going to have some discussion with you on how to keep our businesses safe, and as well as our community in general. So anyway, before we begin, I wanted to give a statement from the Board of Directors and Chairman of the Board, Kevin Van Cannell, on our stance here at the Chamber with the coronavirus. The Greater Brighton Area Chamber will be following the guidance recommended by the state of Michigan in response to coronavirus or COVID-19. All large March Chamber events, including the Economic Development Power Breakfast on March 23rd and Blooming Today for a Healthy Tomorrow, our partnership with St. Joe Mercy, on March 25th, will be postponed until a time to be determined in the future. Small chamber gatherings may still occur, but we will let you know if those are going to be occurring. We'll try to do things remote, and we will try to put on webinars and have conferencing calls. Like all of our community institutions, we prioritize the health of our community and its members. We recommend to everyone that they stay up to date on COVID-19 through the Centers for Disease Control, the Michigan Department for Health and Human Services, and the Livingston County Health Department. Information on how you can prepare your business is available from the U.S. Department of Labor's Office of Occupational Safety and Health Administration and the state of Michigan. So ladies, thank you for being here today. We're here to primarily talk about business, but we'll definitely get into the community as well. Let's talk about contingency planning for our businesses.
Sure, I can cover that.
Okay, great.
So what we're suggesting our community businesses to do is to think about plans that they can start now to develop, or policies that they currently have that they can adapt in case the outbreak affects their agency specific. Things that they can consider is to make sure that they have contact information for all of their employees, including an email address, to make sure that they can send current information to their staff and to alert them if there's a change in hours or days that they're going to be operating. Another thing that they can do is to make sure that they have looked at their staff leave time and their sick time plans. We're encouraging businesses to have some leniency towards penalizing staff who aren't able to come in, or if staff are sick and have to stay home, or if they're caring for a loved one. We want to encourage businesses to support that and not have employees come to work while they're sick or while they're supposed to be home caring for their family members. We also have created two documents. One is for businesses, that's our green copy. It's Get Your Workplace Ready for the Novel Coronavirus. And another one is Get Your Household Ready for the Novel Coronavirus. And these are two documents that we have posted to our website at lchd.org. And these provide some really great guidance and suggestions that businesses can take about contingency planning and getting kind of their policies dusted off to look at and see how they can make changes as this situation evolves.
Thank you. Can you add anything to that?
Yes, so our biggest message for everyone really is to practice everyday preventive actions. This includes things like hand washing, proper hand washing, so using soap and water and scrubbing for at least 20 seconds. Covering your coughs and sneezes using a tissue and then throwing that in the trash when you're done. Staying away from sick people. If you yourself are sick, then staying at home as well. And really just cleaning and disinfecting any surfaces or objects that are used frequently. If we can all do our due diligence to practice those everyday preventive actions, that's going to be the best way to spread or to stop the spread of germs and diseases like COVID-19.
Right. We're hoping that it burns off soon before our festivals, but we don't know, do we?
Mm-mm. Not at this time, no. It's a changing situation and it's evolving daily, so.
Right. It's amazing how it has spread so rampantly throughout the world.
Mm-hmm.
When you look at those maps on television, it causes anxiety.
Mm-hmm.
What should people do for their anxiety? Somebody coming to work on a daily basis and having like anxious thoughts the night before and not feeling rested the day of for their job, how can these people relax a little bit with this? Is there any way they can?
Well, we are encouraging businesses to consider, if you are having staff with anxiety or staff who feel like they need to be at home, to be more lenient with your plans to allow staff to work from home. If they're able to connect via webinar, or if they're able to connect via conference phone, so that they can still operate the programs and the services that they need. If they're able to do that from home, we strongly encourage that. We also are recommending to businesses that if you do not have a webinar system currently in place for your facility, to consider looking into resources that you can use to help employees connect from home. The other thing that we consider for contingency planning and considerations for people who have to work at home is to consider the essential services that must continue for your facility. Some facilities distribute medication, some facilities have to focus on payroll and ensuring that employees get paid. So to really deep dive into your agency and determine the actual most important needs that your facility needs to continue operating if you have to have employees work from home and the virus affects your location.
So if a business should have an employee that does get the COVID-19, and that person is on quarantine at home, does that necessarily mean that the business needs to go into quarantine for 14 days? I think that's a big question for our businesses, because we've never gone through anything like this before.
Right.
Well, the quarantine itself, so for instance, if that individual had come into contact with other coworkers, the employer, those people would need to self-quarantine for a 14-day period. The facility itself would need to be disinfected, like we talked about.
Okay, so the facility would remain open, like restaurants, for instance, or like this chamber. We have so many people coming through all the time. Doesn't necessarily mean that we would close for 14 days if somebody did get the COVID-19 here, an employee, but we just really heavily disinfect.
You heavily disinfect, but the quarantine is really important because allowing sick people to be able to stay home is what's going to really help control the spread of the disease. That's why we're encouraging, if you're able to work from home and continue your operations, if you're able to limit staff from coming in if they've been exposed and they're quarantined, at least operations for the most part can still continue for most agencies.
Right. Unfortunately, we don't know if we've been exposed, and you don't know that for approximately 14 days, right?
From 2 to 14 days.
2 to 14
Yep,
days.
there's no strong guidance for a set number, but 2 to 14.
So we could be feeling fine like today, but we may be carrying it. So take those precautions, folks. So the Centers for Disease Control and Prevention has issued environmental cleaning and disinfection recommendations. So I am going to send that to you, our members, and please read that. It goes into great detail on how to clean, how to disinfect. And then I also have a listing of all the products that really do work with this COVID-19. And so it's extensive. So we hate to tell you to rush to the grocery store because that's already a madhouse, but I'll send you that list too, and then you could prioritize with the cleaning supplies that you buy according to this. So is there anything else that you wanted to add?
I would say just that, as you brought up earlier, there's some anxiety around the situation. We understand it is a scary situation. There's a lot of unknowns and it's changing all the time. But that's really why we are stressing preparedness and taking these simple steps that we know do stop the spread of disease. So I think people can take a little bit of peace in that, and knowing that there are things that they can do to prevent this from hitting their own households.
They say that washing your hands is absolutely the best thing you can do. I mean, we've heard that over and over on the news. And so should you wash your hands for like 20 seconds? Or how long should you wash your hands? Should you sing a song to your hand washing?
Yes.
Some people are doing that. We've heard them, which is cute. But anyway, so like 20 seconds, or how long should you really
At least 20 seconds. Yeah, at least 20 seconds.
At least 20 seconds. So whistle while you work, right, folks?
Whistle while you work, sing your ABCs.
Oh yeah, the ABCs.
Yep, soap and water, ABCs, singing your ABCs 2 times while washing your hands, making sure that when you're washing, you're not just washing your palms, you're covering all surfaces up to your wrists, drying with paper towel, throwing it away. And also, if hand sanitizer is not available, we're hearing that it's in short supply across the county, it's more effective to wash your hands with soap and water. Sanitizer is for if you don't have access to soap and water, so be sure to wash and scrub appropriately.
Anything else?
That's
About it? Well, we want to thank you. We know that this is a very, very busy time for you, and that you are making the rounds with other events probably. So thank you for taking the time here. We care about our members, and we will do everything in our power to try to keep you safe during this time and healthy. And I want to thank our health and wellness, annual health and wellness sponsors that support the chamber through their annual business sponsor. They're very important to us. Okay, thank you.